Well, in today's digital age, Yelp helps you find the perfect restaurant, while TripAdvisor is ideal for hotel and attraction reviews. But what about finding a safe hospital? For 25 years now, Leapfrog has been a trusted site for hospital reviews. But today, it found itself at the center of a major lawsuit filed by one of our area's largest healthcare providers. The Palm Beach Health Network, owned by Tenet Healthcare, is a major healthcare provider in Palm Beach County. It includes Good Samaritan, St. Mary's, and medical centers in Palm Beach Gardens, Delray, and West Boca. Together, they filed a lawsuit against the nonprofit online hospital ratings website called Leapfrog. Here's attorney Mary Beth Maloney, who represents the hospital group.
We're alleging in our lawsuit that Leapfrog holds out its surveys as valuable information for patients, when in reality, it's a brazen pay-for-play scheme designed to line the pockets of its leaders.
Their lawsuit contends if a hospital chooses not to take part in Leapfrog's extensive survey, they can be punished with negative grades. In this case, all 5 of the Palm Beach Health Network properties have been given D's or F's.
The fact that hospitals that earn D's and F's are unhappy with it, frankly, is not a surprise, but it's not something we worry about as a reputational problem for us. Our reputation has long been proven.
Leah Binder is Leapfrog's president and CEO. She says the way they grade hospitals is based on this 350-page survey. It's voluntary and free, but it also takes between 40 to 80 hours to fill out. The Palm Beach Health Network says it doesn't have the manpower to do that. It feels like you guys are holding their feet to the fire to fill this survey out, and if they don't, they get bad grades.
Lots of hospitals choose not to do the survey, and they still do well. And most hospitals do better than these 5 hospitals did on the safety grade, whether they reported to the survey or not. It's just the reality.
They are using metrics that Leapfrog has created from whole cloth, and if you don't participate in their survey, they give you the equivalent of a 0.
Other hospitals have challenged Leapfrog's scoring methods in court without success, and Leapfrog rejects the claim that filling out the survey leads to an automatic low score. You're saying that hospitals that don't participate, that don't voluntarily fill out that survey, they are still able to get an A. And you have examples.
Lots of them do. And they get B's and C's. They get better grades than these 5 hospitals did without completing the survey.
The debate is shedding light on how patients choose the right hospital. Lots of people use Leapfrog and other websites to make sometimes life-saving decisions on where they want to be treated.
Errors and accidents and injuries and infections in hospitals would be considered the 3rd leading cause of death in this country. They kill over 200,000 people a year. So it's a very serious issue. It's something everyone should really consider when they're seeking care in a hospital. That's why it's so important to us and why we put so much time and resource and attention into doing this right. And why we expect hospitals like these to do better. So instead of attacking Leapfrog, the messenger, how about they just fix the problem?
This is a pay-for-play scheme, and they have figured out a way to change the methodology so that if you don't participate, you get a bad score. And it's all with an incentive to drive participation, the licensing fees that go along with that, and also the consulting fees that Leapfrog tries to charge to people to bin up their ratings.
Now, to be fair, I didn't get a chance to ask Leapfrog about that pay-to-play allegation, but the nonprofit does earn money from consulting and licensing fees. Those are usually sold to hospitals who earn a good grade and want to promote it. Online, Leapfrog states that any fees that it does earn help support its work, which they say is protected by the First Amendment, guaranteeing freedom of speech.